Shavua Tov, everyone. Welcome to TillesTells Stories for Saturday night. The title of this week's video is Lefty Power. I found the story in the book, quote, "Excuse me, are you Jewish?" unquote, by Malka Tauger. I must confess I was instantly attracted to this story because I too am a lefty. Howard Butcher, a member of the Palo Alto Chabad House Advisory Board, talked and walked frequently with the director, Rabbi Yosef Levin. 3 times a week, Howard and the rabbi would exercise together, improving their health and solidifying their relationship. Once, when discussing the effort of persuading other Jews to put on tefillin, Rabbi Levin mentioned that he was at a disadvantage because he is left-handed. It's awkward adjusting tefillin made for a lefty on a person who is right-handed, he commented, because the straps and the knots must be positioned differently. "Why don't you get a separate right-handed pair for your outreach purposes?" asked Howard. "Tefillin are expensive," the rabbi replied candidly. "What does a pair cost?" Howard wanted to know. "Costs vary, but you can purchase a quality pair for about $450. A few weeks later, Howard presented the rabbi with a stack of checks made out to Chabad House. The memo line stated, "Towards the purchase of tefillin for outreach," and the total added up to $450. "People were happy to have a share in your tefillin outreach efforts, Rabbi," explained Howard. Rabbi Levin was very touched by the gesture and immediately placed an order with a scribe in Israel. 3 months later, the tefillin arrived. Rabbi Levin put them in his car, along with a packet of brochures explaining the mitzvah of tefillin. A few days later, Howard's daughter called Rabbi Levin urgently. "My father is in the emergency room in the hospital," she said. "We rushed him in with severe chest pains." Rabbi Levin knew it was a serious situation. Howard Butcher was in his 80s and had a heart condition. He quickly drove to the hospital. "As we speak, I am having a heart attack," Howard said with a wry smile. "They gave me medication for the pain, but not for the heart, because they want to do a second EKG during the attack." "How soon will the test be done?" inquired the rabbi. "Right now." Rabbi Levin asked Howard if he had put on tefillin that morning. Howard shook his head. "Well," said the rabbi encouragingly, "you will be the first one to put on the tefillin you sponsored, the right-handed tefillin." He quickly approached one of the doctors. "Can I please have a minute with the patient before you proceed with the EKG?" The doctor got busy setting up equipment and told the rabbi they really needed to do the test immediately. "Just 2 minutes, Rabbi Levin implored. "All right, but only 2 minutes." The doctor and nurses left the cubicle and closed the curtains. Rabbi Levin had the new pair of tefillin with him. He quickly put them on Howard's head and outstretched arm. As soon as the rabbi left, the doctors and nurses swarmed back and the second EKG was administered. The hospital cardiology team reviewed the scroll of results. The note on the doctor's printout stated, "Attack arrested without any intervention." One of the cardiologists had been a yeshiva student in his youth. He modified the note to read, "Attack arrested without any medical intervention." That's right, folks. Let's not forget who's the chief doctor. And let us all be blessed with a year of such good health that we won't need any of the Almighty's assistants meaning doctor agents in this profession.